Hi friends, do you want some key points for your upcoming JIPMER examination and the Sangrur PGI exam? So as usual in this video we have included 20 questions, very important questions which I have taken from different nursing subjects and 5 important GK information. So once again welcoming you all back to the nurse channel, and this video also contains very important 20 questions with detailed explanation, and in explanations I will be providing some key points that you can refer in depth for the upcoming JIPMER examination and the Sangrur examination. So straight away we will move on to the questions. Before that, whoever didn't subscribe our channel, kindly subscribe and support us and share about this platform to your nursing friends so that all nurses will get benefited out of this platform. So moving on to the video, JIPMER series 20 important questions with detailed explanation. Okay.
So JIPMER series, the very first question on the screen right now. The first question for you is a very lengthy question, but it's very important. So the question is, which of the following symptoms observed by the nurse during the first 24 hours after a percutaneous liver biopsy would indicate a complication from the procedure? So the question is very simple. Which symptom? I will be giving you some options. From these options you have to find out the symptom which should be considered to be as a complication after liver biopsy. That is a question for you. Okay. So the options for you are option number A, anorexia, nausea and vomiting. Option number B, abdominal distension and discomfort. Option number D, a pulse of 112 per minute, blood pressure of 100/60 and respiration of 20 per minute. And the final option is pain at the biopsy site. So which is the option answer for the question? So if you use the process of elimination, you can find out the answer very easily. So definitely the answer is option number C, that is a pulse of 112 per minute. That means patient is tachycardic, blood pressure of 100/60, that is patient is hypotensive, and respiration 20. Okay, that is nothing to do with the respiration here. So all these things indicate there is a hemorrhage or the bleeding, and that is one of the biggest complication after a liver biopsy. So we will see that the majority of complications, that means around 60%, occur within 2 hours. Okay, within 2 hours the majority of the complications can happen, and 96% occur within 24 hours after the liver biopsy. Okay, so bleeding usually becomes apparent within 3 to 4 hours. Okay, so within 3 to 4 hours we can see the bleeding, and it often stops on its own, but if it persists we need to transfuse blood if needed. Okay, so bleeding is the major complication of the liver biopsy, and to prevent the bleeding you have to position the patient in which position. That is a regular usual question which is asking in almost all exams, so that I think you know, otherwise you can reference. Okay, so that's all regarding the first question. So moving on to the second question, that is a question is very informative question. Fifth disease is caused by. So here a causative organism of a disease is asked. So which is the answer? Options are option number A, parvovirus, option number B, arbovirus, option number C, rotavirus, option number D, all the above. So which organism is causing fifth disease? So you should understand what is fifth disease, then only you can answer the question. So what is the answer? So the answer for this question is option number A, parvovirus. Okay, so we will see what is the fifth disease, then what are the other diseases, first, second, third, fourth. Okay, all these things I will be explaining in the explanation. So erythema infectiosum, okay, erythema infectiosum, or the fifth disease, or now named as the slapped cheek syndrome, is one of several possible manifestations of infection by the parvovirus B19. Okay, so the fifth disease is erythema infectiosum, otherwise known as the slapped cheek syndrome. So fifth disease typically presents as a rash, and it is more common in children. Okay, so now on what basis this first, second and third disease is made, that we will see in the next slide. So the name fifth disease comes from its place on the standard list of rash causing childhood diseases. Okay, rash causing childhood diseases, which also includes the measles is known as the first disease, then scarlet fever is known as the second disease, then rubella is known as the third disease, and Duke's disease is known as the fourth disease. But now it is no longer widely accepted because it is merged with the scarlet fever. And the sixth disease is the roseola. Okay, so from this question you are getting information regarding the first to sixth diseases, okay, based upon the rash causing childhood diseases they have classified. Okay, so your assignment is to find out the causative organisms for these organisms, okay, for these diseases, so that you can refer for your exam purpose. Okay, so these are some points I am giving for you for better preparation for the exams. So moving on to the next question, that is the third question. So the question is, which of the following is the most commonest site to obtain a capillary blood sugar sample from a neonate? Okay, so this is a common question, but I feel like it is very important, so that's why I included in this session. So which of the following is the most common site to obtain a capillary blood sample for neonate? Okay, so the first one is the ear ape, second option is the fingertip, third option is the heel, and fourth option is the abdomen. So from where you will draw the sample for a GRBS monitoring? That is the question for neonate. That is important for neonate. So the answer is, obviously you know that the answer for this question is option number C, that is from the plantar surfaces. Okay, so the medial or lateral plantar surface of the heel is the preferred puncture site for infants up to 1 year old, including premature newborns. Okay, including premature newborns. So heel, that is medial or lateral plantar surface. So I think that was a very easy question for you. We will move on to the next question in the series, that is the fourth question. So the question is, nursing intervention for a client who is hyperventilating should focus on providing reassurance and dash. So here the question is asked regarding what you will do if a patient is hyperventilating. Okay, so that what you will do. So first of all, we will reassure the client. Then what next step, what you can do? That is a question for you. And the options for you are, first one is administering oxygen. The second option is using an incentive spirometer. The third option is administering an IV containing bicarbonate ions. And the final option is having the client breathe into paper bag. So the key points here are, first one is the hyperventilation. So for hyperventilation, what you will do? So that is the question. Among this option, you can find out the question very easily. So just think about the acid-base imbalance which is happening to the patient if he is hyperventilating, and you can answer this question very easily. So the answer for this question is definitely option number D, having the client breathe into a paper bag. Why? That we will be explaining now. So the main concern for a hyperventilating patient is respiratory alkalosis. So first of all, you have to identify what is respiratory alkalosis. And here in hyperventilation, this respiratory alkalosis is caused secondary to the hypocapnia, because hypocapnia means the blood levels of carbon dioxide, pH of carbon dioxide will be low in the blood. Okay, so reassurances, what will happen with reassurance? First we have to reassure the client. So reassurance decreases the anxiety and it will slow down the respiration. So why a bag is used? The paper bag is used so that the exhaled carbon dioxide can be rebreathed by the client to resolve the respiratory alkalosis, and this in turn this in turn maintains the client acid-base balance. Okay, so we are here focusing for the treatment of respiratory alkalosis secondary to the hypocapnia. So that carbon dioxide itself we are giving the patient to breathe in. Okay, so that's what with the paper bag it will help. Okay, so I think that was a very tricky and funny, tricky and informative question for you. Now we will move on to the other options in the question. So I have told about incentive spirometer. So what is an incentive spirometer that you know? So incentive spirometer, it is a handheld machine, medical device which is used to help patients improve the functioning of their lungs. Okay, so why if a patient is hyperventilating, whether we can give incentive spirometer? Never. So by training the patients to take slow and deep breaths. So in hyperventilating patients we can't provide this spirometer. The spirometer will be training the patient to take slow and deep breaths, and this simplified spirometer facilitate lung expansion and strengthening. Okay, so this is a purpose. Okay, so more about the incentive spirometer you can refer and learn. So these are some key points for you for the preparation. Okay, so another option was regarding giving oxygen. So you know that to reverse the condition, the patient needs to slow down their breathing. So the question was, patient was hyperventilating, so we have to ask the patient to, we have to aim at reducing the respiratory rate. So if you are giving oxygen to a hyperventilating patient, it does not cause the situation to get worse, but it will slowly slow the process of returning the blood gases to normal. So here the aim of of the nurse is to reduce the acid-base imbalance. That balance we have to make. But if you are giving oxygen, it won't harm the patient, but it will slow down the process of maintaining the balance of acid-base. Okay, so that is the reason why we are not giving oxygen for hyperventilating patient. But of course, if patient has saturation is falling, then we have to give. Okay, so moving to the fifth question, that is an important question for GK from GK. So the question is, National Youth Day is celebrated on the occasion of birth anniversary of whom? National Youth Day, and the options already have displayed: Subhash Chandra Bose, Bhagat Singh, Swami Vivekananda and Indira Gandhi. So among these personalities, whose birthday is celebrated as the National Youth Day? That is a question for you. So what is the answer? So the answer for this question is option number C, that is Swami Vivekananda. Swami Vivekananda's birthday is celebrated as National Youth Day, and it is celebrated on 12th January every year in India. So it is also known as Swami Vivekananda Jayanti because it is celebrated on his birthday. So the government of India declared the first National Youth Day or Yuva Divas on January 12th, 1985. Okay, so you are getting so many information from the single question. So I think that was an informative question for you. So moving on to another nursing question in this series, that is a sixth question from nephrology, and the question is, Oliguric phase of renal failure is characterized by dash. So the question is, Oliguric phase of renal failure is characterized by dash. So the options for you are option number A, alkalosis, option number B, hyperkalemia, option number C, hypocalcemia, and option number D, hypernatremia. So there is a spelling mistake in this question, hypernatremia. Okay, so oliguric phase is characterized by what? So in exam point of view, acute kidney disease, then chronic kidney disease, all these things are very, very important. You should thoroughly you should learn. So what is the answer for the question here? So the answer for this question is option number B, that is hyperkalemia. So in each phase, what are the changes happening in our blood? That is very, very important. So we will be explaining about the oliguric phase only here. So the most common initial clinical manifestation of acute kidney disease is oliguria. Okay, which is defined as a reduction of urine output less than 400 ml per day. Okay, so oliguria is manifested within 1 to 7 days of the kidney injury. Okay, so this is the initial clinical manifestation, oliguria 400 ml per day, less than 400 ml per day, and it can happen within 1 to 7 days of kidney injury. So we know that in the oliguric phase, the signs of fluid overload, okay, fluid volume overload, such as edema, distended neck veins, hypertension, pulmonary edema, and even heart failure may occur. Okay, so in addition to the signs of volume overload, there will be metabolic acidosis. This is very, very important. Metabolic acidosis, hyperkalemia, hyperphosphatemia, and uremic symptoms may be present. Okay, so here patient will be presented with hyperkalemia. If hyperkalemia exceeds a level, and if there is a renal parameters exceeds, then patient will be moving to the next stage, and the patient may require dialysis for his problem solvent. Okay, so that is regarding the oliguric phase of acute kidney disease. Okay, so I think that is clear. The other stages are there that you have to study for the exam purpose. Okay, so moving on to the next question, that is the seventh question, easy question but little tricky. So the question is, pernicious anemia can be seen in which client with history of? Okay, so for which patient we can see pernicious anemia? So that is a question in a simple way. So the options for you are option number A, diabetes mellitus, option number B, hemorrhage, option number C, poor dietary intake, and option number D, gastrectomy. So what is the answer? Pernicious anemia. So just think about pernicious anemia. So what deficiency can result in the pernicious anemia? What is the physiology of pernicious anemia? All these things you have to think about and answer this question. So very easy question. So the answer for this question is option number D, gastrectomy. Why gastrectomy affects pernicious anemia? That we will be seeing now. So people who have had a total gastrectomy will need to supplement their diet with regular vitamin B12 injections. We know that the pernicious anemia is caused by the deficiency of vitamin B12 and plus the intrinsic factors which are produced in the stomach. Okay, so two components necessary for the vitamin B12 absorption are gastric acid and intrinsic factor, and are less available or not at all available with the removal of all or part of the stomach. Okay, so here the patient has underwent gastrectomy, so the intrinsic factor will be lacking and the proper absorption of vitamin B12 won't happen, and patient can end up in pernicious anemia. So vitamin B12 supplementations to be given for a patient who underwent gastrectomy. Okay, so the other options are very easy, very clear. So we know that early erythropoietin deficiency anemia occurs in both type 1 and type 2 diabetes. Okay, so type 1 and type 2 diabetes can result in diabetes can result in the nephropathy, so diabetic nephropathy, and there it occurs the erythropoietin deficiency, which can result in the anemia. Okay, so that is happening in the diabetes mellitus. Then poor dietary intake, because of the poor dietary intake there happens the most common anemia is the iron deficiency anemia because of poor dietary intake. So I think that is clear for you. Moving on to the next very important question in this series. So the question is, a nurse is caring for an 8-year-old male with cystic fibrosis. So here the term is cystic fibrosis. Based on the nurse's understanding of the disease, what in nursing intervention should the nurse expect to perform? Okay, so here the client is an 8-year-old male with cystic fibrosis. So what nurse will do for the client? So the first one is restrict sodium and fluid intake. So that's the first option, restrict sodium and fluid intake. Then next one is give anti-diarrheal medications. Then option number C, discourage coughing after postural drainage. Then final option is administering pancreatic enzymes with each meal. So first think about what is a cystic fibrosis, think about the pathophysiology of cystic fibrosis, then answer this question. So as a nurse, what you will perform on a client with cystic fibrosis? I know the question is a little lengthy, but we can expect any type of questions for the JIPMER examination. So what is the answer? So the answer for this question is obviously option number D, that is administer pancreatic enzymes with each meal. Okay, why? So first, you know what is cystic fibrosis. So about 90% of people with cystic fibrosis have sticky mucus that can block the ducts in the pancreas, and it prevents the enzymes from reaching the small intestine to digest the food. Okay, so proper digestion of the food won't happen, plus the pancreatic enzymes are not draining into the intestine through the pancreatic duct and the common bile duct and all, because of cystic fibrosis these ducts can get blocked, and it will prevent the release of these enzymes into the intestine to digest the food. So what we have to do, we have to provide pancreatic enzymes with each meal. Okay, so that's all regarding that question. I think that was very informative. Now moving on to the 9th question, very important GK question. Who is known as the Missile Women of India? Missile Woman of India. You know that who is the missile man? Dr. APJ Abdul Kalam. Then who is known as the Missile Woman of India? So the options for you are option number A, Tessie Thomas, option number B, Kalpana Chawla, option number C, Priya Jingan, and option number D, Captain Abhilasha Barak. So who is known as the Missile Woman of India? So the answer for this question is option number A, Tessie Thomas. Okay, so the other options like Kalpana Chawla, Priya Jingan, and Captain Abhilasha Barak all are very famous personalities in their field that you can refer and see. Okay, I am not going in depth about this question because it will ruin our time. So Tessie Thomas, she's a scientist at the Defense Research and Development Organization, that is DRDO, and she served as the project director for the Agni 4 and 5 missiles, making her the first woman to lead missile teams in India. So that's why she is known as the Missile Women of India. Okay, Tessie Thomas. So moving on to the very next question in the series, that is the 10th question in the series. The question is, while caring for a patient with an ileostomy, the nurse would expect the ostomy to be located in which quadrant of the abdomen? So the patient is having ileostomy. So in which quadrant of the abdomen you can expect the stoma? So that is a question for you. And the options for you are option number A, right lower quadrant, option number B, left lower quadrant, option number C, left upper quadrant, and option number D, right upper quadrant. So where you can expect a stoma of ileostomy? That's a question for you. So what is the answer? So the answer for this question is option number A, that is right lower. Why? Right lower. So we know that the ileostomy, what is an ileostomy? Ileostomy is a surgical operation in which a damaged part is removed from the ileum and the cut end diverted to an artificial opening in the abdominal wall, which is known as a stoma. Okay, so this is the ileostomy. So where it is located? So it is located at the terminal ileum in the lower right quadrant of the abdomen. Okay, so where you can find the stoma? Lower right quadrant of the abdomen. Okay, so regarding ileostomy, colostomy, in our older videos also we have added some questions because it is very, very important. So whoever didn't watch those videos can go and watch that videos. Okay, really it will be helpful. So moving on to the 11th question in the series. So this is regarding the wound healing, that is the incisional wound healing, and the question is, the incision is clean and the edges are well appropriate. So for a patient, the incision is clean and the edges are well appropriate. Then this type of tissue healing is classified as which of the following? Okay, so here the incision is very clean and the edges are well appropriate. So how the intention happened, that is a question for you. So the options are, the first one is the primary intention, the second one is the secondary intention, third option is the tertiary intention, and the final option is the superficial epidermal intention, whatever it is. Okay, so what is the answer for this question? So the key point here is the clean and edges are well appropriate. So that is a question. So the answer for this question is definitely option number A, that is primary intention. Okay, so what is primary intention, that we will see now. Healing by primary intention occurs in wounds with dermal edges that are close together. Okay, so we have told that the edges are very clean and appropriate. That means the incisions which are made with the scalpel, okay, with the scalpel blade, that is scalpel incision. So it is usually faster than by the secondary intention, and it occurs in 4 stages that you know. That proliferative stage, those stages already we have explained in our old videos, so I am not going to explain further. So here the intention is happening, the wound closure is happening by primary intention because it is very clean, edges are there, and the incision is made with the help of a scalpel. Okay, that much clean wound is there. Okay, so what is the secondary intention? So secondary intention means healing by secondary intention occurs when the sides of the wound are not opposed. So that is an important point, the sides of the wound are not opposed, therefore the healing must occur from the bottom of the wound upwards. Okay, so this is the answer for another question, in which type of intention or the wound closure the healing happens from bottom to upwards. So that is another question that may ask. So that is in the secondary intention where the sides of the wound are not opposed. Okay, so that is secondary intention. Then what is a tertiary intention? Tertiary intention means otherwise known as the delayed primary closure. So it occurs when a wound is initially left open after debridement of all non-viable tissues. Okay, so this is occurring when it is occurring, the wound is initially left open. First the wound was left open and the debridement was done, and it was kept open after debridement. Okay, so the wound edges may be surgically approximated following a period of open observation when the wound appears clean and there is evidence of good tissue viability and tissue perfusion. Okay, so for a period of time the wound will be kept open, debridement will be done, then non-viable tissues will be taken out, then the wound closure happens. Okay, so that type of wound closure is known as the tertiary intention, or otherwise known as the delayed primary closure. Okay, so with this question you are getting information regarding primary, secondary and tertiary intention, and some stages are there that you can refer later. That also is very, very important. Okay, so as I told at the beginning, we have very limited time. Okay, so moving on to the 12th question in our series, and this is also very, very, very important question. So the goal of the shrinkage device is to form the residual limb into what shape? Okay, so here the question is regarding the shrinkage device. So shrinkage device is using for what purpose? For the amputation. After the amputation, this shrinkage device is used. Okay, so after using this shrinkage device, how will be the shape of the limb? So that is the question. Okay, so I think the question is new to you. So the option is option number A, it will be cone shaped. Then option number B, the limb will be in the oval shape. Option number C, the limb will be in the mushroom shape. And option number D, the limb will be in cylindrical shape with blunt end. So what is the purpose of shrinkage devices after amputation? So what is the answer? So the answer for this question is option number D, that is cylindrical with blunt edge. Okay, so we will explain about the shrinkage devices with the help of a diagram. So here we can see a picture where a limb can be seen before using the shrinker and a limb after using the shrinker. Okay, so shrinkers, these are used to reduce, prevent or control the swelling in the below knee residual limb. Okay, so it will control the edema. So they are designed to fit snugly and apply pressure to the soft tissues of the stump, and it will be like a blunt edge will be there, like the cylindrical shape will come, along with that there will be blunt end will be there. Okay, so the main purpose of these shrinkage devices are to prevent the edema. Okay, so I think that was a new question for you, very informative. Moving on to the next question in the series, and the question 13th question, very important GK question. How many years did it take to build the Taj Mahal? So Taj Mahal, one of the wonders, world wonders, and very proud to have Taj Mahal in India. So how many years did it take to build the Taj Mahal? So the options are option number A 30 years, option number B 22 years, option number C 32 years, option number D 26 years. So how many years total it taken to complete Taj Mahal? So option number B 22 years. Okay, so we have a small explanation. Building of the Taj Mahal began about in 1632. So the mausoleum itself was completed by about 1638 to 39. Then the adjunct buildings were finished by 1643 and the decoration work continued until at least 1647. So in total, the construction of the 42-acre complex spanned 22 years. Okay, so the total area of Taj Mahal is 42-acre land. Okay, so some information for you. Moving on to the next question in our series. So that is the 14th question in the screen right now. So the question is regarding scabies. The most widely used treatment for scabies is. So the question is, the most widely used treatment for scabies is. Option number A 5% permethrin, option number B mometasone, option number C benzyl nicotinamide, and option number D clobetasol propionate. So what is the answer? The most widely used treatment for scabies, most widely used. So which is the answer? The answer for this question is option number A, that is 5% permethrin. So the other options like mometasone, clobetasol, propionate, these are using for the eczema, dermatitis. Then this benzyl nicotinamide, it is a content of the thrombophob, what we are applying for the thrombophlebitis. No? So along with the heparin, we can see benzyl nicotinamide in that. So the question here asked was regarding the scabies, and 5% permethrin is the answer. Okay, so the two most widely used treatments for scabies are permethrin cream and malathion cream. Okay, malathion lotion. So both medications contain insecticides that kill the scabies mite. Okay, so permethrin 5% cream is usually recommended as the first treatment, and malathion 0.5% lotion is used if permethrin is non-effective or ineffective. So permethrin and malathion. First is permethrin, then malathion. Permethrin is 5% and malathion is 0.5%. Okay, so that also is a really important question for you. We will move on to the next question, that is the 15th question. I think this also is a very important question, very new question for you. How will you position the patient after vitrectomy? So what is vitrectomy, and what is that procedure, and how the patient should be positioned after vitrectomy? That is a question for you. And the options are option number A semi-Fowler's position, option number B prone position, option number C dorsal recumbent position, and option number D Sims position. So in which position you will place the client after vitrectomy? So what is vitrectomy? So first of all, we will find out the answer for this question. So we have to place the patient in prone position after vitrectomy, prone. Okay, so what is vitrectomy? So as the name indicates, it's the surgery to remove some or all of the vitreous humor from the eye. Okay, some or all form of the vitreous humor from the eye. So we have to position the patient in the face down or the eyes down position. So that can be accomplished by keeping the patient in the prone position. So this positioning is only required during the waking hours. So whenever patient is awake, so we have to provide eyes down position, and when not during sleeping time. So it is recommended to sleep on either side or even your front, but not sleep on your back, as that would make the bubble move away from the macular hole. So here I have mentioned about a bubble. So you know that for the retinal detachment surgeries and for the eye surgeries, the surgeons used to instill an eye drop into the eye to prevent the pressure within the eyes, and this bubble will be remaining in the eyes for a maximum of 10 days, 2 to 10 days. Okay, so that bubble should not be dislodged from the eyes, and it can affect badly for the surgery what they have performed. So face down or the eyes down position is the best position for the patients after eye surgeries, like retinal detachment surgeries, for the vitrectomy, etc. Okay, so I think very informative question for you. We will move on to the next question in our series, that is the 16th question. Another very important question. A patient with acute Crohn's disease has been prescribed an elemental diet. So the most likely rationale for this is to. That's the question. So first of all, you should understand what is Crohn's disease and its pathophysiology. Then you should understand what is elemental diet. Okay, so then only you can answer this question. So we will see the options for this question. The first one is to reset the bowel. Option number B, to improve the nutrition of the patient. Then option number C, to improve the medication absorption. And option number D, to prepare for surgery. So what is the purpose of providing elemental diet for acute Crohn's disease patient? Acute Crohn's disease. So what is the answer? So the answer for this question is obviously option number B, that is to improve the nutrition. Why? So that we will be seeing in the explanation. So first of all, we will see what is an elemental diet. So an elemental diet is a diet that proposes the ingestion, or in more severe cases, use of a gastric feeding tube or intravenous feeding of liquid nutrients in an easily assimilated form. Okay, so it is usually composed of amino acids, fats, sugars, vitamins and minerals. Okay, so whenever there is a problem with the absorption of the minerals and vitamins or the proteins, then we have to provide the diet in a liquid, in the form of a liquid nutrients that can be given through the tube or the intravenous feeding, and it will contain amino acids, fats, sugars, vitamins and minerals. So this is known as the elemental diet. So in this one, Crohn's disease, this research has shown that the elemental diets can be effective in the nutritional management of Crohn's disease. So the answer for our question is for providing the nutritional support for the patient. Okay, so I think that also was very informative question for you. We will move on to the next question in the series, that is a 17th question from GK chemistry. So at what temperature is the density of water at its maximum? So we know that the density of the water will be in the maximum at which temperature? So the options for you are option number A, 0 degrees Celsius, then option number B, 100 degrees Celsius, option number C, 4 degrees Celsius, and option number D, 22 degrees Celsius. So at what temperature the density of the water is at its maximum? So 0 degrees Celsius means the water will be ice, so that you can omit easily, very easily you can omit. So the other options, so here the answer for this question is option number C, that is 4 degrees Celsius. So the density of water is maximum at 4 degrees Celsius temperature. That was a easy basic chemistry knowledge for you. Moving on to the 18th question from genetics, very important. So the question is, dash is a genetic disorder with an autosomal dominant pattern of inheritance in which the arms and legs are short while the torso is typically of normal length. So here we are asking about a type of dwarfism. So you know that here in the question they have clearly asked the arms and legs are short, but the torso is typically of normal length. Torso is of normal length, but arms and legs are short. So that is a question for you. So options are, first option is the achondrogenesis, option number B, achondroplasia, option number C, acrodysaustosis, then option number D, acromesomelic dysplasia. Okay, so these are the options for you. I know it's slightly tough question for you, but you can refer regarding the dwarfism, then the types of dwarfism for the exam purpose. Okay, so what is the answer for this question? So I'll be explaining about all these options in this session itself. So first we will see the answer for this question, that is achondroplasia. So what is the achondroplasia? Achondroplasia is a genetic disorder with an autosomal dominant pattern of inheritance whose primary features is dwarfism. So what type of dwarfism? So in those with the condition, the arms and legs are short while the torso is typically of normal length. So that is achondroplasia. So next we will see what is achondrogenesis. So achondrogenesis is a number of disorders that are most severe form of congenital chondrodysplasia. So what do you mean by chondrodysplasia? It is a malformation of bones and cartilages. So these conditions are characterized by a small body, short limbs and other skeletal abnormalities. So here the body is small, but before we told that torso is of normal length, that is achondroplasia. So we have explained about achondrogenesis. Then another option was acrodysstosis. Okay, acrodysstosis. So it is a rare genetic disorder which is characterized by skeletal malformations, growth delays, short stature and distinctive facial features. So this is the key point here, distinctive facial features, which is caused by underdeveloped of certain facial bones, particularly those in the middle portion of the face. Okay, so facial abnormalities will be happening in acrodysstosis. Okay, so that is a key term for you. And the final option was regarding the acromesomelic dysplasia. Okay, so it is an extremely rare inherited progressive skeletal disorder that results in a particular form of short stature known as short limb dwarfism. Okay, so short limb dwarfism is otherwise known as the acromesomelic dysplasia. So and there are several types are there. Acrodwarfism is there, then mesomelic dwarfism is there. Those things are in detail I am not explaining now because we have very limited time, so you can refer it later. These are the key points for your exams. Okay, so that's all regarding that question. I think that was also a new question for you, I think so. So we will move on to the 19th question, which is a GK question. Which Indian airport uses only solar power to run its operations? Okay, so the fully solar energy based Indian airport. So that is a question for you, and the options are: first one is a Delhi, option number B Mumbai, option number C Bengaluru, and option number D Cochin. So which is the first Indian airport uses only solar power to run its operations? So the option number D, Cochin, is the answer. Okay, is the first and the currently running Indian airport which uses only solar power. Okay, so moving on to the very last question in the series. Very last question. We will end up this session with a very important question. So the question is: which among the following anti-TB drugs can cause most drug-induced hepatitis? Okay, so which anti-TB drug can cause most drug-induced hepatitis? So the options for you are: option number A ethambutol, option number B isoniazid, option number C pyrazinamide, and option number D rifampicin. So which can cause most drug-induced hepatitis? So among these, except one drug, the other three drugs are hepatotoxic. Okay, so the question is regarding the most. So what is the answer? So the answer for this question is option number C, that is pyrazinamide. So we will have a small explanation regarding the question, and with that we will wind up this session. So isoniazid, rifampicin and pyrazinamide are potentially hepatotoxic. Okay, so these are potentially hepatotoxic, and ethambutol is not at all hepatotoxic. Okay, ethambutol is the exception, and among these three, that is isoniazid, rifampicin and pyrazinamide has been shown to induce greater hepatotoxicity than the other first line anti-TB drugs. Okay, so the answer for our question is pyrazinamide. And one more information for you. So rifampicin is the most frequent anti-tuberculosis medication associated with acute interstitial nephritis, that is nephrotoxicity. So this is an additional information for you. So with this question, with this informative question, we are coming to the end of this session, and I think the 20 questions what we have explained today was very useful for you, because all questions what we have, including the GK, are very important, and I think that I have given you some new information also. So with that we are coming to the end of this session, and once again thanking you all for watching the video till the end, and stay tuned, prepare well, all the very best wishes for your upcoming exams. So see you soon in the another video. Till that time, signing out. Thank you.